What is this? Oh my God. When did you start experiencing this, sir? Where have you been assessing your treatment? Which native doctor is that? It's not someone that is doing you this thing, Papa. It's somebody. It's not somebody. It's not somebody. This is a medical condition. This is called venous ulcer. Have you heard about it, sir? Or venous stasis? Yes. Have you not heard about the venous ulcer before? Have you been following Kunye page before? No. In that page, I've explained about this venous stasis and venous ulcer very well on the place. You need to start following us there to know more about. Of course, I'll tender you some help. Okay? I will tender you some. But meanwhile, this venous ulcer is as a result of the vein in your lower legs not being able to transport blood back to the hands. This is actually the cause of this venous stasis on your leg. And there are so many other medical conditions that can cause this. Where have you been assessing treatment about this, ma'am? Herbalist drug, for Christ's sake? No, you are in the wrong place, ma. You need a professional, you need a health professional that will handle this. You need a medical doctor that will tackle this, and not all these native doctors and herbalists.
Today, I want to give you a short video on venous ulcer. You may call it as well venous stasis ulcer or stasis dermatitis. By stasis, you know that there is something seasoned, there is something that is not moving. So because it has to do with non-movement, sedentary life, and the rest of other factors, clotting, everything revolves around not being active. So venous ulcer developed from diseases like diabetes. It's developed like diseases like hypertension. Is developed from what you call venous reflux or venous obstruction too. Why? It is the result of high blood pressure in your vein. Yeah, the high blood pressure that we know very well is the one in the artery, this time in your vein, and it's measured down in your leg area. So when that leg area, which is supposed to have a dropped blood pressure when you are moving, has a higher blood pressure while you're moving and gets sustained, then you are at risk of suffering this venous ulcer. Because when it is sustained, if you have any slightest injury in that leg, you see that that leg will begin to develop to a sore that will last for a long period. And the treatment is something that has to take a very careful doctor to get you back again, or be managed depending on how you treat the disease. So carefulness has to be taken, because a lot of people in different cultures have given this disease different names and seen it as a myth and even a mystery. So we need to understand that the disease is treatable and the disease is real based on your body's mechanism. So it is about blood pressure. And when your blood pressure is affected, many other things are affected. So someone who is suffering from this will have to equally desist from anything that will cause him high blood pressure, because those are factors that will equally cause him. You talk about smokers, you talk about sodium, salt, you talk about high fat, sedentary life, that's not sitting at one place, maybe because of the kind of job you do. An IT person or whatever job, many people started doing more sedentary lifestyle after COVID. You have to be careful of how you sit and ensure that you do exercises, because this kind of disease could equally manifest, especially when you have the risk factor. But that does not mean you will sit to wait if you think you don't have the risk factor, because there are several risk factors. But the science will list the one they know. You don't know if you have the one they didn't list. So we have to be careful. And what are the other risk factors, or the risk factors we are talking about? Someone who has what you call deep vein thrombosis. Yeah, it's a blood clotting disease. That's one particular factor that can lead someone to having this kind of disease. It's a big factor, and number one that has to be watched. So you have to really know if or if not. Family history. Family history is another factor. So many diseases we have mentioned or treated here, we have mentioned family history as being a part, a major role, playing a major role in terms of someone's diseases. And that has to be really watched when you are assessing yourself or trying to evaluate if you have this. Another thing is obesity. See how it's linked to blood pressure again? Fine. Obesity. If you are obese, this has to be equally, you have to do everything to ensure that you come back to normal weight, so that you don't begin to suffer this added to the obesity you're already suffering. Older age, while aging, do not forget exercise. Active life helps a lot in solving a lot of these problems that we are talking about. So we talked about sedentary life, paralysis, or even one who has a surgery of the hip or knee, call it hip or knee replacement. Those could equally lead you to this kind of, because of course it could be kind of sedentary after doing such kind of surgery. So we're looking at all this. We have to know that we may not equally escape if we do not live active life, which is very important in everybody that is watching this video. And your own relatives, let them know that watching Kunye could help them understand. Because when this comes, when this sore develops, it is very ugly. And people call it different names. That if you look at it, you might not want to do so much. And it leads often to amputation because it's very vulnerable to infection. And a lot of people who suffer from it end up getting amputated. That is even a luckier one, because when you're gone, it goes to the extent of suffering from sepsis. That is blood infection, and you rarely come out from it. So if you do, that means that you have a very good medical treatment, which people do too, but you don't have to allow yourself to get in there. So this is a very difficult, very dangerous disease, and we need to really ensure that we know what it is, know what causes it, know how to prevent it. Stop smoking. Manage your blood pressure by doing the right things. Eat healthy. Exercise. Those things will help you while you prepare yourself, because the test that you have to do, there are tests you have to do. There is the ankle brachial test index. There is equally the imaging that you will do. There is equally the, this ankle brachial, you have the ankle brachial, you have the Doppler test, you have the imaging or like scan. So these things will help you while you do this. Try to find out what is wrong with you. And then the symptoms that manifest, the pain, the sore, the foul odor, and the rest of them will begin to aggravate and accumulate and make you really feel very bad of yourself. So let's avoid getting into this problem. And before then, getting into it, let's equally learn what causes it from Kunye. I love you and enjoy you on this program, and wish you to come back here again for the next edition of our program. Today, some other time. But always stick with Kunye, because we're here to help you understand your body. I remain your regular host and anchor on this program, also the specialist, and I'd say have a very good day.